We could have two tactical responders wearing the same gear in the same conditions doing the same job, and one can look really fresh, the other can look really fatigued. That's going to come down to our VO2 max. Now, VO2 max is the maximum amount of oxygen that our body can utilize during high intensity efforts. For tactical responders, a 42 to 45 VO2 max, which is milliliters per kilogram per minute, is what's recommended. Now, how do we test for that? We can go to a lab. There are labs that are popping up that allow you to do this, or we can just do a field test. So a simple field test that is recommended to determine your VO2 max is a 1.5 mile run. 1.5 mile run, you should do it at a track. You run at a pace that you can comfortably hold for that entire time, and you're going to record your time and be able to check with a VO2 max chart that's online that will tell you, depending on your time, where your VO2 max is going to fall. Now, for reference, for a 42 VO2 max, that's going to equate to a 12-minute 1.5 mile run or an 8-minute per mile pace. So if you record your time and you're not exactly at your 42 VO2 max, what you're going to do is you're going to try and train. But how do we train to increase our VO2 max? Two different ways. So we can do aerobic training, which is going to be at a 70% of your VO2 max intensity. So this is usually your long, slow distance runs, rowing, cycling, something to that effect. And that's going to increase your left ventricle size. So the ventricle is actually going to get bigger, which is going to allow it to fill up with more blood. So each beat of the heart is going to pump more blood, which means more oxygen traveling throughout the body. Now, the other option is your higher intensity. So when you do higher intensity, which is your interval runs, your HIIT workouts, Tabata workouts, anything that's pushing the heart rate to get very high, very intense, that's going to increase the wall thickness. So the thickness of the ventricle is going to grow like a muscle growing in size. It's going to pump harder on each of those beats that it has. So if your heart has more blood that fills up and a stronger contraction, it makes your heart easier to work. So that engine is going to become more efficient because it has the more blood and it has a bigger contraction. So these are the two ways you can make adaptations to be able to increase your VO2 max. As a tactical responder, if you increase that VO2 max, you're going to feel better physically, which is going to make your response better mentally because you're going to be less fatigued. So in your high pressure situation, you can feel better and have a better response to keep you safe as well as everybody else safe.